Dr. Barbara Rath, welcome to Vaccines Today. Thanks for your time. Could you tell us a little about how you see technology shaping the future of immunization?
I think it will help to bring the vaccines and the end user closer together, getting rid of some of the middlemen, including us doctors, to some degree. I think it'll be important to discern at which point a vaccine recipient or a consumer, whatever you want to call it, a person, right, wants to have the support, feedback, consultation by a physician, and at which point they really just immunize and get the situation done in the most convenient and least invasive way. And that doesn't just include the vaccination event itself, but also the time leading towards that event and the time after. And it can also help to understand these things better in the family context, for people to keep their records straight, to understand what's next, at which point who will be recommended to be vaccinated. I think it's still very difficult for any person, including healthcare professionals at this point, to keep up to date with the rapid changes and recommendations for different types of vaccines in different situations and different backgrounds and risk factors and whatnot. So technology can help to make that a lot more accessible and understandable, and the expert knowledge less arcane. To translate some of that expert knowledge into simple messages, visual or otherwise animated or gamified, whatever we want to do, to really get people engaged and understand that there's reason behind the madness of vaccine communication, at least from a professional context, and that there's their best interest in mind in any way possible. But also, last point, that the feedback is welcome. It can be a very important feedback loop to receive questions, to receive concerns about adverse events following immunization, any of those things, that a person who has received a vaccine also know immediately where to turn if there's anything that they would like to report or anything that they would like to know more about.
And could an app help to reach marginalized groups such as migrants who maybe don't have their medical records, including immunization records?
Yeah, we're working on that right now with the Vienna Vaccine Safety Initiative. We're coordinating a large EU consortium that's called Innovative Immunization Hubs, where we're trying to really do grassroots work with communities of people who are usually marginalized or falling through the cracks of the system one way or another. There's a lot of issues with cross-border healthcare in Europe and a strong European mandate in that area, and we take that seriously. So yes, absolutely. I think the smartphone usage in Europe has increased drastically, and we are working in combinations with analog and digital tools here to make sure we're not excluding anyone. But modern digital tools can come in any way possible. They can also be used at these immunization hubs in form of a tablet, for example. Modern digital apps can also help the hearing is disabled or people who have difficulty reading small texts with voice recognition or other modes that are better than any piece of paper could do. So it will never replace paper and tactile information. I think it's still good to have something that we give people, like a booklet or something where they can even reflect on their own familiarity with digital tools. But on the other hand, you want to integrate yourself in that life. It doesn't make sense to be shy on the use of digital tools. Meanwhile, everybody's finding conflicting vaccine information online. We have to keep up with the pace of information moving more and more digital.
And do you think apps could be used by clinicians to aid diagnosis when they have someone who has a disease that could be COVID, but could be flu or RSV or something else?
Maybe not so much well, there are interlinkages that are interesting, that we've done a lot of work working with diagnostic tools and making sure that there's integration between the abstract diagnostic test results, working away from the academic medical center, closer and closer to people in the actual community. There's a project in the US that we've done that is really moving the needle here. In moving towards real-time, also mapping and surveillance of influenza, RSV, and COVID incidents and the individual disease severity of each case. using an app to help understand the digital severity of illness. We're also doing a lot of work now to understand what does severity mean to the clinician and what does it mean to the patient when you are sick, because we may have very different movies going on in our heads, whether I'm attending a clinic or whether I'm the one who has to discern whether that's something urgent or that's something that has to be referred further. And in those situations, making the best of the person's time when they go to the clinic and improving the continuity of care. Digital tools can be really helpful too, because we have that fragmentation between different types of care providers, the pharmacy, community clinic, the ER, the hospital, hopefully not the ICU, but if that's the case, then that as well. And a patient sees themselves as having to tell the same story over and over again to different people. And there's a lot of inconsistency, a lot of disruption there in a not positive way. So helping a person throughout the course of illness to have that continuity, to be able to monitor themselves as well, according to the things that matter to them, would be very helpful, yes.
You mentioned the European dimension a moment ago. Could you tell us about the project you're involved in at European level?
Yes, so there are several projects. Some are related to, River EU and Immunion. We're really having a strong focus on education, and we're working closely with the European Pediatric Academy of Pediatrics. But also, I'm involved also with the American Academy of Pediatrics and the International Pediatric Association on different training programs, and learning a lot about how that can be done, also using digital tools more and more often. The other in Immunion, we're really using technology very much so in these immunization hubs. The intervention there indeed has to do with digital use, and we're going far into detail to understand how people would receive this and how they are willing to participate in those kind of activities. And we're using multiple apps that have been developed and validated by the Vienna Vaccine Safety Initiative over the past 10 years. One is really geared towards measuring severity of illness in patients who have any form of flu-like illness is not just respiratory, so really is often a whole body experience. And that includes COVID, flu, and RSV, importantly. Then we're working with the Vivi Health Survey. That was something that was initially designed for people on the move, migrants, people who have to evacuate from natural disasters and things like that, to understand their health needs, acute and chronic conditions, and risk factors. So that modules of that will be integrated into the VAC app, which is the known tool that we use to help or people, not everybody's sick, people understand their own and their family's vaccination status, but not just as a to-do list, but to really understand what these vaccines are for. And if there are uncertainties, to really seek the help of a healthcare professional and initiate the vaccine communication from their end to understand, listen, I'm uncertain here, I'm reading my vaccination pass, I'm not clear what this means here, this little scribble, does that mean I'm protected against X, Y, Z? These are the kinds of conversations we would like to have happen in medical clinics, or even in routine well child or well people visits, and that has to happen more. And I think when this comes from the patient themselves, it's the most valuable form of communication. If it's really clear that that's not just superimposed onto somebody, but it's something that they want to know, that's where we want to go into a more active position. We have worked on other apps as well that are not part of this project yet, but that may be part of future projects that help people monitor, especially, first of all, the healthcare professionals, but later also the patient safety aspects of vaccination. And that is complex to understand which kind of data need to be known by a regulatory agency or a pharmacovigilance agency. That doesn't need to be the everyday knowledge of a routine, GP or a pediatrician. They don't need to know the intricacies of that, but they can use technology to send the right kind of information, to solicit and send the right kind of information when they see something that looks off to them, right? And to involve the patients there more and more is very much in line with what both the European Medicines Agency and the FDA are looking for lately, is a more and more information that is unfiltered, coming straight from the patient or vaccine recipient themselves. And it's a good thing for us healthcare professionals to convey that message to the patients, that we want them to be accountable and to be taking on some of that diligence in reporting, because they are the best source of information when there's anything untoward that happened to them, or anything happy as well. You know, the benefits of vaccination should also be reported. That's the other point that I think technology can be helpful for, because these tools are things we're using every day. And monitoring myself, I'm monitoring progress or the absence of disease as well. That's very important. I think the absence of disease should not just be an absence of a note in a medical record. It should be positively noted. You know, that's currently very, very important during times of COVID, where I find the communication going very, very poorly in some aspects. I just had a conversation with a friend yesterday who was talking about her husband who was vaccinated, but then had COVID, and I asked a little bit more. I said, what exactly happened? Well, turned out he had no symptoms. He hadn't transmitted to anyone in the family, including 2 little babies. He had a positive PCR test. Okay, not everybody has spent years in virology labs and knows that that's a forensic test that amplifies a very small signal to the maximum. And that mostly means that that person has been exposed. The PCR test is not a proof of an active infection. So these are things that are not well communicated. And I would like to see technology playing a bigger role here in interpreting test results for the user as well, to say, if you want to know more about what this means, then this can be, you know, discussed with the infectious disease societies or other stakeholders. Well, how do we word this? Or the public health agencies, you know, what does this mean? Can we agree on that statement? And then to provide that as part of the technical tool for people who want to know more about their results and what that means in terms of public health and their own family.
Well, thank you very much, Dr. Rath. I think between new vaccines and new technologies, hopefully there's a lot of positive things on the horizon. But for now, thank you so much. And we look forward to seeing what happens next.
Thank you.